Before we're joined by Kevin Madden, we wanted to play you a little bit more of Jake Tapper's interview with the president. He asked the president about that shooting incident at Fort Hood last week. As you know, the president's traveling right now to Fort Hood for the memorial service.
Here are the two things I can say right now. Number one, we are all heartbroken by what happened at Fort Hood. The second thing I can absolutely commit to is that we are going to complete this investigation and we are going to take whatever steps are necessary to make sure that something like this doesn't happen again.
And we're joined now by Kevin Madden, Republican strategist and second biggest fan at this table of the world champion New York Yankees. Kevin, thanks for being here. Let's start on Afghanistan. We're expecting to have a decision now after the Asia trip. How difficult is it going to be for the president to sell this to his own party? You heard Senator Cardin there say that there's a lot of skepticism inside the Democratic Party about additional combat troops, and that seems to be where we're heading.
Sure, it's going to be very difficult, and I think that is a result of trying to constantly find the middle ground. This is a president, I think, who is defined by his willingness, his ability, or his desire to always constantly seek out the path of least resistance. And when he does find that middle, unfortunately, he finds himself in the middle of fire from both sides. Those that are very supportive of a more robust presence in Afghanistan are going to criticize him, and those that believe that the president is not holding true to a commitment to wind down those conflicts is also not living up to that promise. So I think it's going to be very difficult. There's no easy options here, and I think he's tried the White House, from a posture standpoint, has tried to make that clear to the public from the very start.
And on that point, politically, I think Martha Raddatz and Jake Tapper have both been reporting that McChrystal's request is still very much one of the possibilities that he is looking at here, and a lot of tea leaf reading out there may suggest that he's going to go with a larger number of troops. And I'm wondering if you think politically all of that work, the public display of how long this process is taking, releasing the photos from the War Council meetings, letting the country see how deliberative it is, if perhaps he helps bring on his base a little bit that might be reluctant.
I don't know, because I think I'm very skeptical about that, because I think ultimately they care about the substance of the decision. Right. The left, right. The more liberal portion of the audience that he's kind to play to. And ultimately, I think the reason that they did it was part of the process, and the process isn't what they really care about. The process here was to try and draw a contrast between the Bush administration and the way they deliberated about these type of decisions. And when you focus too much on process and not enough on the substance, again, I think that you put yourself in a very difficult predicament with not only your allies, but those of you on the political spectrum who are your opponents.
Kevin, as you know, last week a big storyline was Republicans eating their own, New York 23 in the battle for the heart and soul of the Republican Party. Well, it's the Democrats this week that are having similar issues.
Only like 6 days.
Yeah, hey, isn't this great? We can talk about the other side. Did Nancy Pelosi, though, misplay this? I mean, she cut a deal, obviously, with the pro-life members of her own caucus to get a provision included here that would include some new abortion restrictions as part of the public option. But there's been a big backlash.
Yeah, this is one of those cases where when you map out the first 5 steps in front of you, without looking at the next 5 miles, you put yourself in a very tough predicament. And right now, this abortion debate, usually you see these abortion debates between liberals and Republicans, liberals and conservatives, Republicans and Democrats, and now it's being had within the caucus, and that has served to be a distraction. Any time that this debate is distracted away from the public's main concern, which is costs and secondarily access, they begin to really hurt their ability to provide a unified front, make the case to a larger public, and therefore build some political capital behind the momentum that they're trying to achieve on health care.
They had enough hot button flashpoints in this debate before.
They didn't need another one. We're going to be arguing about this, and then when we get to the Senate part of the equation, it's going to be about public option again, and it's going to be about
immigration.
It's going to be about immigration, and again, this debate is it mystifies me. It really does. The debate is being driven by costs.
What do you make of the vote that happened on Saturday night? How much do you believe that is a political liability for vulnerable Democrats in the fall that voted with the Speaker and with the President? Obviously, the NRCC, the campaign arm, is out there already trying to drive that home. Is that a political vulnerability, or do they have an argument to make back saying we did something to fix healthcare, which is a major problem?
It's a major vulnerability right now. And when I talked about the debate being driven by costs, I mean that the American public wants to see a bill that's going to drive down their costs. The debate in the public is being had about costs. And I think the NRCC has a they can filter back very easily to the American public that what happened in Washington, D.C. was just another $1.2 trillion bill on top of all the other additional spending that the Democrats have introduced since they've taken over. And I don't believe that. I think what the Democrats did, what Nancy Pelosi and those up on Capitol Hill did, was convince these guys that it would be a bigger mistake to do nothing than it would be to pass something that has an enormous bill. But I just disagree. I think if you look at those Virginia Democrats who are in districts that Bob McDonnell won by 4 points, how are you going to convince them that by voting for something that cost $1.2 trillion that you're really challenging the status quo in Washington?
But is the better political alternative at this point to abandon health care?
I don't think look, abandoning health care, no. I mean, I think the cost of inaction is very great, but I think if you look at polls, a large majority of people say either start over or go back to the drawing table and fix what we have right now, scale it down. And I think Republicans are better aligned on those sentiments with the public than Democrats are.
All right. Kevin Madden, Republican strategist. Appreciate you being
Always
here.
great to be with you guys.
Thanks a lot, Kevin, and congratulations on the Yankees win.
Thank you. It was all me and Rick.
Yeah, we called it in 5. It ended up being 6.
Yeah, you both are wrong. I'm not listening to your
as long as they
predictions
win.
going forward. That does it for this edition of Top Line. Be sure to click us on again tomorrow.
Twitter.com/The Note. Keep the conversation going.
Like Tom Perriello also voted for cap and trade. I mean, he voted for cap and trade
Good luck now.
and
Yeah.
healthcare.